Jessica, for arranging today. I appreciate you taking your time out to listen to this information. My name is Dr. Lawrence Pilevsky. I'm a pediatrician, originally trained at NYU School of Medicine, graduated in 1987, finished my residency at Mount Sinai Hospital in New York in 1990, and did a fellowship at the Bellevue Hospital in the outpatient department. The first 9 years of my career were spent in ERs, running an intensive care unit, working in a neonatal intensive care unit, working inpatient in the hospital, working in a clinic, and then eventually having a private practice. In 1983, when I started medical school, I was taught vaccines were safe and they were effective and give them. But I was not taught about any of the science around their safety or any of the studies around how safety were done. And it wasn't until 1998 that a mother came up to me and said, "Dr. Larry, did you know that there's mercury in vaccines?" And I said, "No, I did not." And as a medical student, I was trained to critically think. If you see an observation, you go after it and try and figure out if there's a question to ask. So instead of just ignoring it, I looked further into the vaccine ingredients. And I found that there were a number of vaccine ingredients that in animal studies were proven to be very dangerous to animals. And I didn't understand why these same ingredients were actually in vaccines. I was starting to hear stories from parents, not dozens, not hundreds, but thousands of stories from parents who took a very healthy child into their doctor's office and then found that their child lost much of their health, whether it was their speech, whether it was seizures, whether it was death, whether it was asthma, allergies, eczema, whether it was autism, whether it was learning disabilities, whether it was inflammatory bowel disease, autoimmune diseases. And every one of those parents were told it had nothing to do with the vaccine. Every single one. And this continues today. But yet, when I look at the ingredients that are in the vaccines, I have the science to actually explain how these medical problems could be happening in these children. Today, one child in 5 is learning disabled. In 1976, it was 1 in 17. 1 in 6 under age 8, 1 in 2 adolescents, and 1 in 4 young adults is diagnosed with a mental, behavioral, or emotional disorder. 1 in 20 children under the age of 5 have seizures. 1 child in 40 develops autism. The number of cases of children and adults with autoimmune diseases is rising exponentially. It's one of the highest rising diseases in this country. And the vaccine ingredients, if you are willing to look at them and understand how they work when they're injected into the body, can be seen to be responsible for every single one of these cases. So what are these ingredients? Well, when I was in medical school, we were taught that the body has something called the blood-brain barrier. The blood-brain barrier is like Fort Knox to the brain. Elements of the bloodstream cannot get into the brain. And those elements include drugs, viruses, and bacteria, among other things that are in the blood. Drug companies were very concerned about being able to develop drugs to get the drugs into the brain. And so they used something called a nanoparticle. Nanoparticle, very small particle, bound to the drug. And they found that if they could put a nanoparticle onto a drug, they could get that drug to go into the brain. And it shows in animal studies that they were able to do this. They then were able to take an emulsifier, which is something that's good with water and fat. It can dissolve in both. And if they added the emulsifier to the nanoparticle bound to the drug, they could increase drug entry into the brain 20-fold. This is right out of animal studies that I've found. So you have a drug, you have a nanoparticle, and you have this emulsifier. The vaccines are constructed the same way. You have the vaccine viruses and bacteria that are bound to a nanoparticle called aluminum. And that aluminum is a nanoparticle, and by definition, a nanoparticle has the potential to enter the brain. Most vaccines also contain polysorbate 80 or sorbitol. Both of those compounds are emulsifiers. Emulsifiers bind very tightly to the nanoparticle aluminum, which is bound very tightly to the vaccine antigens. This raises a question. If the vaccine model is the same model as the model that the drug companies are using to enhance the delivery of drugs into the brain, is it possible that vaccine ingredients are making their way into the brain of our children that could explain why so many parents are watching their kids deteriorate after vaccinations, even though the doctors, the media, and the government say absolutely no connection, even though the science suggests that there is? You cannot find a single study in the literature that addresses whether the injection of aluminum into the body penetrates the brain, whether any vaccine ingredients enter the brain, and whether polysorbate 80 enhances the delivery of any of those ingredients into the brain. And when I could not find those studies, I was concerned, because I'm told, you're told, vaccines are evaluated and very, very distinctly tested for safety. But yet, you cannot find a study that says, does aluminum get into the brain of children? Does aluminum take other vaccine ingredients into the brain that don't belong in the brain? Because when ingredients get across the blood-brain barrier that don't belong in the brain, they cause inflammation. And inflammation is what we see in 1 in 5 children with learning disabilities and 1 in 40 children with autism. And we have all you have to do is ask the guidance counselors. And if you get honest pediatricians who are telling you what they're seeing in their practice, they're seeing kids one after another with more and more brain disorders. Now, as a medical doctor who was taught to think, I then went into the literature and said, are proper science studies done, safety studies, where you take a vaccine and you inject it into 100 kids, and then you give 100 kids a saline placebo, meaning it's inert. No study exists to actually evaluate the safety of a vaccine compared to a placebo group. None. When vaccines are studied, the maximum amount of days that vaccines are studied are up to 10 days to 2 weeks. And unfortunately, the vaccine manufacturers pre-select what side effects they will allow to be associated with the vaccines. So if a child has a vaccine reaction that is associated with the vaccine manufacturers will decide whether or not it should or should not be associated with the vaccine. And the public knows this, and they're learning it more and more. So if your child develops seizures 5 months after a vaccine, your child is told by the doctor it had nothing to do with the vaccine. But that's not true, because there are no studies to prove it. There's opinion, but there's never been a study really addressing whether a vaccination at 2 months or even 9 hours of age could be related to an event that happened months or even years later. And yet we have some of the sickest children in our country. In New York, we lost the religious exemption on June 13th because the unvaccinated children with a religious exemption were blamed for a measles outbreak. When I met with representatives in New York, I told them that there is no study to prove that unvaccinated children have ever been proven to start an epidemic. And he was surprised. And he said, I will vote against removing the religious exemption if I can't find a study, like you say. He could not find a study, but he voted to repeal the exemption anyway. Because there are no studies. There are no studies proving that unvaccinated children are responsible. There's consensus And here's why there's consensus.